Hello, fellow type 1s out there. Today we're going to talk about insulin on board and correction factor, right? These things we need to think about and we need to think critically about them because sometimes when we're high and we want to take a correction, we can't just think, what's my correction factor and take that. There's more thought to it than that. So that's what we're going to discuss in today's video. Maybe you're just finding me, maybe not. I will tell you who I am. My name is Dr. Jody Stanislaw. I help patients who are struggling with type 1 diabetes have less highs and less lows so you can confidently live a joyful and vibrant life. My favorite technology that I use is my Dex. I'm doing pretty good. I have a nice flat line here today. This month, June, look at that. I'm very proud of that. This month, June, is my 40 years with type 1. So very exciting. I'm old school. I use shots. I do help patients with pumps, but I just have a great diabetes life with my shots. So that's what I'm using right now. And I've been coming live on Facebook ever since we kind of got locked down and for COVID. So this is into month 3 of doing Facebook Lives, right around 3 o'clock Pacific, 6 o'clock Eastern. My last patient I ran a bit late, so I'm a few minutes late today. But you can find me on Facebook. Sometimes I do these lives on my Facebook page, my business page, but I also have a personal profile page. So I've been trying to figure out which page to go on, but hopefully you can find me. There's definitely 2 months of these videos if you want to check out all the topics I've talked about, incredible tips on my personal profile, which is Jody A. Stanislaw. But let's talk about the question today. So I was just talking to a patient about this, about correction factor, right? What is your correction factor? Well, the correction factor refers to how many points does 1 unit of insulin drop you. So maybe you take 1 unit and it drops you 30 points. Maybe you take 1 unit and it drops you 100 points, right? That means you're very sensitive to insulin. Well, we kind of can't only think about that ratio when we're high, right? Because if you're 200 and 1 unit drops you 50 points, do you really need 2 units right then? Well, maybe not, and this is why. Well, how much insulin do you already have on board, right? If you already took 2 units an hour ago, maybe those 2 units are just starting to peak. So maybe although you're 200, you don't need to correct at all because those 2 units just need to get working. And here's a great tip. To get your insulin to work faster, go be active. Even if it's 5 minutes, 5 minutes on elliptical, 5 minutes jumping jacks, 5 minutes walking around the block, 5 minutes walking up and down stairs. I guarantee you, if you want to get a high to come down faster, sometimes you just need to activate the insulin that you already delivered. Okay, so in that case, you're 200, you might not need to correct at all. You might just need to make the insulin you already took work faster. Now, on the flip side, what if you wake up and you're 200? Well, I'm going to assume if you woke up and you're 200, you don't have any insulin on board. So that's one of the only times where your quote insulin correction factor would be 100% accurate, right? If 1 unit drops you 50 points and you want to be 100, you don't have any insulin on board from a previous bolus or shot, you haven't eaten anything, and you just appear 200, then yeah, you'll need 2 units. You need that first unit to get you to 150 and that second unit to get you to 100, right? Now, what happens if you're 200 and you ate a whole bunch of food? Maybe you forgot to dose for your food. So your correction factor doesn't really apply there because you really have to figure out how much insulin, how much food you ate, and then how much insulin you should have taken for your food, right? So my point is, there's a lot of quote false precision in diabetes. They try to just give us these formulas like here's your insulin to carb ratio, here's your correction factor, and then they try to simplify it for us as if that's all we need to think about. And the reality is it's not that simple, right? We always have to use critical thinking. We always have to think, well, I'm 200, but I have all this food that hasn't digested yet. Or maybe I'm 200 and I'm now going to go for a run. So maybe I don't need to correct at all because my run's going to bring me down. But my run is only going to bring me down if I already have insulin on board because in order for exercise to make me go low, I actually need insulin on board. So we always have to be thinking, What insulin do I already have in my body? What food is going to be digesting? What activity am I going to be doing? And once we ask those three things, food, exercise, and insulin, then we can make an educated decision on what we should do with our 200, right? So if you want to go deeper in learning about this, I have incredible courses that I've made on my website, drjodynd.com. It's listed right there. And my passion is to help patients with type 1 diabetes get healthy blood sugar levels, right? We need to have a 6.5 A1C or lower. The majority of us deserve that. American Association of Clinical Endocrinologists recommend a 6.5 as the upper limit of a healthy A1C. And the reality is over 80% of type 1s are not there, right? So I promise you, these courses can change your life. They can give you simple tips that so many patients have been giving me feedback on, have changed their life. I just had a patient today said, this is the most valuable training I've ever seen in my 30 years with type 1 diabetes. So the first course I recommend is how to get off the blood sugar roller coaster. The second is nutrition and how to dose for food. And the third is master your blood sugar with exercise. If you're type 1 and you're struggling, I promise you that these courses will improve your life. I've had type 1 for 40 years, and my passion is helping you get off that blood sugar roller coaster. So check those out and check out my Facebook page. I got lots of free tips, free videos, free handouts on my website. Well, one free handout on A1C. But my classes are life-changing. I've put a lot of time and effort into making them excellent and easy to digest for you. So thanks for watching today's video. Check out my website. Have a great day. Here's to living a long and healthy life with T1D. Bye for now.